for joining us today for December's Share.Solve.Evolve webinar series. Today's topic is 911 Lessons from 2024 and Challenges for 2025, a year in review. Today, we are joined by Scott Brillman and Melanie Jones. Trying to switch to the next slide and it won't move. There we go. Scott Brillman is Director of 911 from Fairfax County. And Melanie Jones is President of NENA and Executive Director of Guilford County. I am going to turn everything over here to Jeremy DeMar, our host, shortly. If you guys have any questions, though, during the webinar, please use the Teams Q&A feature in the kind of top middle part of the panel. Go ahead, pop your questions into that Q&A feature, and we will address them towards the end of the event today. All right, Jeremy, without further ado, it's all yours.
Well, good morning, everybody. Happy holidays. I know you guys hear me say when these sessions start up how super excited I am, but I am truly super excited to be here today with two of my dearest friends in the 911 biz. We've known each other for a long time, and I know you're going to take a lot away from the conversation. I'm excited to hear what they have to say, and I'm also excited, obviously, to get some feedback from our participants. We had the most registrants ever for today's event, so I think it's going to. I'm very hopeful it's going to play out really well today. But we're going to cover some really cool topics. We're obviously going to do a little bit of a recap from last year or from this year. We're still in this year. Here I am rushing into 25. We're going to do a little recap of 24 and then really probably focus the majority of our time on what's to come. And these two folks, as the screen finally is formatted correctly in front of me, thank you, Marie and others on the Intrado side that are helping out in the background. But I don't think either of you need an introduction. I think everybody on here knows who you two are. I certainly do. But I do want to give both of you an opportunity just to kind of do a quick intro, and then we'll hop right into it. So, Melanie, I'm gonna ask you to go first with a quick intro.
Thank you, Jeremy. Good morning, everybody. My name is Melanie Jones. I am the Executive Director of Guilford Metro 911 here in Greensboro, North Carolina. I have been with the city of Greensboro for 26 years and been in the public safety business for 36 years. And I am honored to be here today.
Awesome. Thanks, Melanie. Scott?
Thanks, Jeremy. Scott Brillman. I'm the very proud director of Fairfax 911. But before that, retired from Baltimore after 20 years, ran their 911 center and dabbled in emergency management a little bit. But thanks for having me on. Dabbled,
yes. And you can see the flurry of activity behind Scott. So it's a really cool setting. I have to give accolades, of course, and if you've been on one of these calls before, you know that the panelists, the participants, and myself, we kind of meet for around 15 or 20 minutes prior to the session in the green room, just to kind of level set. So I have to give accolades to my wife, as many of you know her on social media, the Queen. She did ask me this morning. She says, "So you're having your year-ending session today of Share.Solve.Evolve?" I said, "Yeah." She goes, "What are you going to wear?" I said, "What?" She goes, what are you going to wear? I'm like, "What do you mean, what am I going to wear?" She goes, "You're not just going to wear another blue shirt or something, right?" I was like, "Okay, I guess I'm not." And so this little, outfit, entourage, for lack of a better term, this is thanks to my wife saying that I needed to be more festive today. So I have my festive holiday colors on. So if you appreciate it, you can give a thumbs up. You can thank my wife for this. This was all her doing. So, but again, thrilled to have you both here, and I want to jump right into it. So Share.Solve.Evolve, the webinar series, for those of you that have not participated in this before, I think this is either our 9th or 10th session. So we started this endeavor in October of 2023, featuring a variety of different folks from all different walks of life within the 911 space. I think both Scott and Melanie have been on previous sessions before, so we're obviously glad to have them back. And I know that they're going to have a lot to contribute as we go through the question set. But what we really want to do today, and there will be opportunities, there's a chat field available to all of you that are participants in here. Feel free to ask questions. Marie is kind of keeping an eye on that, so she may inject every once in a while a question that comes up if it's appropriate to the subject matter that we're talking about at this time. But do feel free to ask questions as we go along, especially when we get into the track about 2025 and really what's to come for the 911 community. I think that's going to be a big part of this. So without further ado, let me hop right into it. it was difficult for me to select really the hard-hitting topics from 2024 because there were so many things that we talked about this year. But the hard-hitting topics for 2024, we want to touch on a few of those, and then of course we want to jump right into kind of where things are going. So I don't think there's anything more appropriate from a 911 perspective to talk about right now than the challenges we've been facing from a recruitment and retention standpoint. This has been an extremely difficult year. I know in talking to centers that I used to be a part of and other ones throughout the country, just about everybody is struggling when it comes to not only keeping the staff that they have, but of course, recruiting new ones. In fact, I was talking with Scott a little earlier today in our green room prior to the session, and Scott, maybe it's a good way to start off. You were just out talking with a school, right? You mentioned you were trying to recruit some of these folks. Maybe you could talk a little bit about that to kick the conversation off.
I was just talking to a couple of high school students about how I used AOL years ago, and they said, "What is that?"
What's AOL?
Yeah, I was talking about all the cool technology that's coming out that they'll be able to figure out for us because we don't really know what to do with it, and so I was trying to get them excited.
Did it work?
I think so. I don't know.
Time will tell if those applications start coming in. We'll see.
Yeah.
Melanie, any opening thoughts on that?
No, we've seen some success actually in 2024 with recruitment, especially because of our benefits packages that we've added to in the last 3 years. We actually had over 100 applications in January, most we've ever had. And so we've seen a plethora of people actually coming now and wanting to be here. And so it's a change for us, and I'm very happy to see it.
Yeah, there were. Oh, sorry. Go ahead, Scott.
No, I just want to mention that I want to acknowledge that the past few years have been really scary for all the centers, for all the directors, for all the dispatchers and call takers and 911 specialists. And it's been really rough seas, but I think the tide is turning. Yeah. And I see a lot of centers becoming better staffed. And I also see some fantastic branding out there on Facebook and social media and websites, and they have testimonials. And so a lot of great work is being done around recruitment and retention. But I think that, things are looking a lot brighter out there in our industry.
I was going to say, when you were talking to those high school students, did they even know what Facebook was? Because my daughter, who's just turned 22 and she's a senior in college, she's like, "Dad, nobody uses Facebook anymore." I'm like, "I still use Facebook."
They said they use Instagram. they don't use Facebook.
Yeah, so we try to be present in all these areas. But I think to your point, Scott, I mean, you're out talking to high school students. We have to be leveraging these different platforms. We have to be reaching out to these folks, these younger folks, the Gen Ys and the Gen Zs where they are. And frankly, if it's not on Facebook, we need to get with the times and get to where they are. So I'm glad you're taking some proactive steps there. I think this is a good segue also. I mean, Scott, you talked about how we're seeing more things going on from a social media standpoint. We're seeing agencies really going above and beyond, not only to keep the talent that they have, which is critical, but to recruit new talent. I think a big part of that, and I know when I was a director a short time ago, National Public Safety Telecommunicators Week was such a huge week for us. I mean, the events, the different things that we plan for our folks, just the basic, I mean, obviously we want to say thanks all the time, right? But this week really gives those of us that are leaders in the 911 space the ability to go above and beyond for our teams and really recognize them. So we actually had a Share.Solve.Evolve session where we had some dispatchers on earlier this year. And again, any of you that are on the session today, if you have not, if this is your first Share.Solve.Evolve session, first of all, welcome. We're thrilled to have you here. But you can go into, Intrado's got a website where all of these Share.Solve.Evolve webinars are available. The one on National Public Safety Telecommunicators Week is absolutely near and dear to my heart because we actually featured folks from the front lines talking to them about their experiences and so on and so forth. But what did the two of you do? Melanie, let me throw it back to you. How were you able to recognize National Public Safety Telecommunicators Week for you folks this year?
So we have an award ceremony every year during the week of National Public Safety Telecommunicator Week. And we actually have congressmen and senators that usually will be in attendance, and people from our governor's office, and then our local elected officials as well. We actually celebrate the number of life saves during that week that our team was credited with during the last year. And so in April, we had 53 life saves from the last year
Wow.
that our telecommunicators were credited with from EMS. And so, just for EMS to include us, they started that several years ago. And so we have life-saving awards that each person gets for when they have a life save. And then we have annual telecommunicator of the year, support person of the year, and rookie of the year. And so we have those as well. And we get an outside entity to read the nominations and select the winner so that it's no one in-house.
Awesome. Activities on the floor, I'm sure too, theme days, that kind of thing. I would imagine that's a big part of it as well.
Oh, for sure. They love football jersey day.
Who doesn't love football jersey day? I won't mention the team I'm a fan of. Some of you watching probably know, but it's not been a good year for us. In any event, Scott, how about you? I mean, actually, I see bags behind you on the table there. I don't know if that was a prop or a setup for today, but it kind of got me thinking. I bet Scott. Okay, Scott.
I hope nobody from my shop is watching this because this is Secret Santa over here.
I hope I didn't blow the secret for you. Sorry. What did you do this year?
We also have awards, which is fantastic. We bring elected officials over, and we definitely let the community know, all about what we do here. But on the floor, every day is a different theme. They're doing contests down there. I let everybody break the rules. They really can do what they want as long as they, dispatch calls and answer calls. But one of the crazy things we did this year was we brought in alpacas to the center, which not in the center because risk management kind of pushed back a little bit on that. But outside the center, we had alpacas, so people could bring their kids and their families to the center. And I don't know if I have a picture here, but we could,
get a
hug
picture
them
with an
and
alpaca.
pet them, and they're potty trained. So
yeah, I was gonna say, you say potty trained. I'm like, was custodial services concerned about this event too? But
we didn't even think about that. But,
sounds like it was good.
Yeah, it was a really fun time, and it's important to have fun.
Yeah, and I'll echo that. And again, for any of you, for any of the directors on there, I mean, I know you can reach out to Melanie or Scott to talk to them, but there's so many cool things. And one of the things that I think I love the most about National Public Safety Telecommunicators Week is, Scott, to your point earlier about social media, so many, it seems like every year more and more centers are coming online and saying, hey, here's how we're recognizing our folks. Here's some of the amazing things that these people are doing. Here's what we did to celebrate the work that these amazing folks do every day. I love seeing that, man. I'll tell you, that whole week, just to have it really being all about our professionals, the ones that are in the seats every day doing this amazing work. I love being able to celebrate that. So, and I know the two of you do as well. Last point I really wanted to touch on before, and again, I mean, recognizing we only have an hour and we have a lot of information to cover. We had a session earlier this year about technology adoption challenges. And I think with the way that the technological climate is right now, with things changing so dramatically, with all of these offerings coming from different industry partners and different providers, as directors, I know when I sat in the seat as a director, one of the things I always prided myself on was when an industry partner or a vendor would reach out and say, hey, we've got this or we've got that, we want to talk to you. I would usually try to accommodate them as best I could, because minimally, even if I wasn't going to operationalize something, I wanted to learn about what was going on. I wanted to be a part of that process. I'm sure the two of you get inundated with these requests as well, but part of me feels like we have an obligation as leaders in this space to minimally to learn about it. Doesn't mean we have to go out and turn the key on it immediately, but at least learn about it. So, but with so many things coming out right now and so many different things going on, what are the two of you seeing, or what did you see in 24 from a technology adoption standpoint that might have been a little bit more of a challenge for you? Scott, are you want to speak to that first?
Sure. I mean, this year more than previous years, vendors have come to us probably a couple times a week going, you got to try this new tool. You got to look at this. You got to buy this. And I love it. I love the innovation going on, but it's really tough for humans to adopt and to change and to implement. And we're very cautious here around that. And so I tell the vendors, I go, we'll look at it. It's great. You have a great product, but it has to be easy to implement without minimal onboarding, minimal training, and no clicks of the mouse, right? We don't want an extra click and an extra login. You really got to work with existing vendors to make sure it's integrated. And that's what I tell the folks. But the other thing I think about when I think about new technology is the community. Like how, first of all, is it useful for us, but is it useful to the community? And or is it a burden? And so if we're implementing a non-emergency system, will it be able to do languages, 170 languages, or will they not understand it if you're a non-English speaking person to when they call in? So I think about that stuff when we're looking at new technology.
Nice. Thanks, Scott. Melanie?
One of the things that we've seen the most success for in 24 was implementing a citizen feedback link and providing a monitor outside of the 911 center. And when they get off the call with us, a link is sent to the citizen to provide feedback for how their caller experience was. And so our call takers get to see live feedback on that screen, and they love it. I mean, people that are calling in saying, showed great care, showed great empathy, those types of things. And they love seeing that feedback. And it just scrolls, as the day goes on. And that's one of the best things we implemented because people really enjoy seeing positive feedback.
Yeah, and I think when you see things like that, in fact, the first center I worked for up in Rochester, New York, they had done that a little bit into my tenure, and we would get those things back. But you can tell when the feedback that you're getting is just people clicking to do it just to say I'm doing it. I mean, it's not like a hotel or a restaurant survey, right? Where you're like, yeah, they didn't bring my appetizer on time or they didn't refill my drinks. I mean, generally speaking, if somebody's going to go to the extent of completing a survey relative to an experience they had with public safety or a government agency, I think the comments that you're generally going to get are pretty genuine. So that you're absolutely right, Melanie. I love seeing those. I love being able to read about those. And I think it also gives leaders that operate in this space the ability to say, hey, we recognize that maybe this score was a little lower than we wanted to be, and there's opportunities to learn there as well. So the feedback is critical. I know one thing for me, and I have fessed up to this. I mean, as one of those early adopter disruptors, I mean, when I was a director, I was like, oh yeah, that's a cool new widget. I want to do that. And I'll be the first one to tell you, there were a couple of times when I got so excited about it, I was like, hey, we're just going to do this. We're going to roll it out without really taking enough consideration about what the impact on my team would be. I think I only did that maybe once before I got some honest feedback from my team. And I said, you know what, how do we help navigate this process a little bit more effectively so that number one, I'm leveraging new technology, new advances, but I'm also including my folks as part of that process. So I think when we talk about overcoming technology adoption challenges, I think a big piece of that is what is the impact on our team going to be? And the way that I started looking at it as I was considering new solutions is, number one, I'd create work groups or teams of all my frontline staff, not just supervisors, not just training folks, dispatchers, call takers, all those folks. We'd bring them in and we'd have kind of a talk, a conceptual talk, if you will, about, hey, here's something we're looking at. Here's something we're thinking about. And these folks would provide all kinds of cool insight, all kinds of ideas about why it will work, why it won't work. You don't have to be that far removed, and I'm not telling either of you anything you don't already know. You don't have to be that far removed from the operational side of this business to kind of lose touch with what's going on your floor. So having that input from your folks, I found was critical. And there were things after the fact that when I had these sessions, I decided against maybe deploying this particular technology immediately, maybe waiting a little while. So having that input, understanding what the impact is going to be on your folks' workflow is a big part of that. And I think that's a big part of addressing the challenge. So before we kind of hop into 24, I'm keeping a close eye on the time here because I want to make sure we get to these other topics. Asking both of you, and we didn't rehearse this, folks. I mean, everything that we're talking about today is just off the cuff. But do either of you have any last minute comments or thoughts about 2024 before we kind of head into where we're headed? No? Look, they're ready to dive into 25, folks. They're ready.
Full speed ahead.
They're ready to dive in. All right. So I'm super excited about this part. I know I said I was excited in the beginning, but this is where the feet hit the street, right? This is where we're going to be talking about things that are definitely going to be impacting our agencies, our public safety partners in the new year. So there really, in my opinion, is no better place to start than with AI, with artificial intelligence. And this is the this is the big topic right now. This is what everybody's talking about. If you're not talking about it right now, especially from a leadership standpoint, it's something that you really need to be talking about. I attended for the very first time this year IACP, the International Association of Chiefs of Police conference in Boston, and I will tell you. First of all, never having been to that show, I didn't realize it was as big as it was. But so many of the segments there, so many of the sessions were AI focused and machine learning, and just you can see how entrenched this technology is getting into all aspects of public safety, not just law enforcement, for which IACP was the emphasis, but all aspects of public safety. So let me just throw it to you guys. I do have a couple of questions, but I don't even know that I'm going to need to throw those out. Melanie, let me throw it back to you and just kind of get your 10,000-foot view of where you think we are on AI now and kind of where you think it's going.
So I think AI, I think, needs to be accepted as a solution to help remove some of the stress from our telecommunicators. I have given my IT manager my word that I will not throw anything else on him until our new CAD system is fully implemented. But he is aware that AI answering for my non-emergency lines is on the radar. There are so many places across the country that have already implemented this successfully, and it's taking anywhere from 35 to 45% of a call volume off of the telecommunicator, which then allows them to be available for the emergency calls. And that's imperative that we see the benefit of implementing something like that. Anything, to Scott's point earlier, that can take a mouse click away, that can take a command line away, just one, every little bit helps. And we need to be doing what we can to improve that for our people.
Yeah. Scott?
Yeah, exactly. I call it assistive AI because it sounds a little bit more friendlier when I talk to the folks down there. I want these tools to assist you and not do your job. Like, your job is, you have to have a human in there to make decisions. And AI can't do that for you. But AI is going to save lives, like the language translation, the voice transcription, listening to radio channels, picking out keywords, sending that data to a real-time crime center. It's all going to save lives. The one thing that I think we should be cautious as a profession is when we do implement AI and there's a technical glitch or an interruption, that our folks can go back to typing again and to listening again. I don't want to be at a point where everything's automatic. And then we forget the skills, our original skills of listening, typing, and talking. And so that's my only caution with implementing all this, assistive AI technology.
Yeah, and I think that's an awesome point, Scott, for a variety of reasons. But number one, I think back again, when I started out my career, one of the things that our center did really well is at least once a year. It might have even been twice a year when we started. But at least once a year, we would have basically, whenever they needed to do a reboot of the CAD system, we'd have a shutdown drill or a loss of service drill where we'd pull out the yellow cards and the blue cards and the white cards, and we'd have to timestamp things, and everything. The process was manual. But I think in some degrees we become so reliant on technology that these things, to your point, Scott, I mean, being able to not fully automate these processes, but to have it done in such a way where it's assisting, but not necessarily replacing, that's the big piece of this, because we ultimately have to be able to flip that switch at any moment and go back to, I'm switching to manual. I'm going back and doing it the way it used to be done. So we still see centers out there, and I'm hoping centers, if there's a better way to test not having your systems, I'd love to hear about it. But I'm hoping centers are still saying, hey, let's do the worst case scenario test and just make sure everybody's familiar with, writing, how to put stuff on cards. I mean, when I found out when my kids were in high school that they weren't even teaching cursive or handwriting anymore, I was like, okay, either I'm getting very, very old, or we're just not. Maybe we just don't have a need for it. In fact, the notes I'm taking during this session, I think about the number of things that I handwrite anymore. We just don't do it. Everything's on keyboards or in emails or texting. So So I don't want to make myself sound like a dinosaur, but I think we still need to be thinking about that and what that works, how that works. I think the other side of this is the objection side, right? Because I think there's a good chunk, not just in the public safety community, but in general, there's a good chunk of folks out there in leadership roles that kind of put the hand up and say, you know what? I kind of want to see what others do with this. I kind of want to see how this unfolds or how this is working. And Melanie, to your point, I mean, you were talking about some of the conversational AI applications that are out there right now to leverage non-emergency calls, which I think is awesome. But that wait and see, that wait and see attitude is in some ways inherently dangerous because we as leaders don't want to really maybe accept a lot of liability. We don't want to take that risk. We want somebody else to kind of test the waters for us. But unfortunately, we're kind of in a circumstance right now, especially being leaders of 911 centers across the country, where, God forbid, something happens in our jurisdiction and these technologies could have helped prevent that. Now I think we got a little bit of egg on our face with that. So, Melanie, what are your thoughts from a liability standpoint and really handling those objections?
Well, I think to Scott's point, we will never replace employees with assisted AI. I mean, we need the 911 professionals in our industry to understand that. You don't have to be afraid of it. It is there to help you.
Yeah.
And I think the more we drive that home, the better off it will be. Yeah, I know I shared earlier with you all when we were planning this. I have a friend of mine in the industry that's allowing citizens to enter calls in her CAD.
Yeah.
That is beyond my comprehension.
Yep.
And it's working. And so that's something that is just, I mean, we've got to, I mean, of course they make mistakes, but she gives them the option. And, like I said, I think that's great. But that terrifies me. And so we have to sometimes be willing to step out on a limb if it's going to help. So.
Yeah. Scott?
Oh, Jeremy, the private sector is using it and it's very successful. And the public sector, we struggle with this. We struggle with going from horses pulling fire trucks to motorized vehicles. Every few years we struggle, moving into the future, but AI is here. I think we're kind of using it already. But I'll tell you, just knowing what's going on around the country, and I think APCO and NENA together are helping feed information and bringing us together, and finding solutions and sharing information. I think that is the first step to jumping into AI and all these emerging technologies.
Quick shout out to Steve Martini and Melanie for the just exceptional work they're doing with both NENA and APCO and the collaboration. For those of us that have been in this industry for such a long time, to really see these strong folks working collectively and together on these. I mean, I just bright hopes for the future. So thank you, Melanie, and I'll be sure to reach out to Stephen after this and thank him as well. But I think as we kind of continue talking about this, and there's a variety of different directions that we go with this, but ultimately at the end of the day, we have to be able to leverage these technologies to our benefit. And again, it's not something that we're hopefully nobody is taking this as, hey, you need to operationalize this today, but minimally be willing to have conversations. When I've gone out, when I've done presentations at APCO or NENA or other conferences, I generally end my sessions with, if you take nothing else away from this session today, as a leader in the space, just be open to conversation. Be open to learning more about this. It doesn't mean you have to do it today or tomorrow, but God forbid, I don't want something bad or traumatic to happen in your communities where these technologies could have been there to help offset that or maybe prevent it. I think we look at the way the pandemic rolled out, and I'm glad that we can kind of talk about the pandemic in a past tense now. But think about those organizations, those entities that first operationalized dispatch from home, call taking from home. Prior to the pandemic, nobody was talking. I mean, come on. We're gonna let our folks dispatch and call take from home. Now it's become far more commonplace. We're seeing that, so ultimately it takes a major challenge, and certainly the pandemic was one of those. It takes a major challenge for us to really look at technology and say, hey, you know what? we've got to do something. We've got to come up with an idea here to kind of address this. I think the recruitment and retention strategies or challenges that we talked about earlier are a big part of why AI is being successful. And Melanie, we'll go back to the conversational AI applications that are out there. I think back to the number of administrative and non-emergency calls that my folks had to answer in my centers. That solution was not readily available at that point. But to know that I could have a secondary application out there vetting these calls, determining if they're not emergency and being able to handle them that way, or to go to the extent you're talking about with one of our colleagues that now has people entering their own CAT events from home. I'm still blown away by that. Melanie shared that with me, and I was like, holy cow, wow, that's something. But again, if we're not looking at these from that perspective, are we truly going to be able to grow from a technology standpoint? So,
and it all ties back to mental health. Melanie, when you said, I love the feedback form idea, because they get more positive feedback, it's great for them. And getting rid of non-emergency calls or pushing them somewhere else, great for mental health, so they can focus on their job.
Yeah, no, that's and how many times that I'd walk out onto the floor and I'd hear those phones ringing, and I'm like, I just shake my head, because then I hear the regular 911 calls coming in, and of course those have priority, but somebody still needs to answer those other calls. Anyways, I mean, I think we could talk about that for days. Any other last thoughts? Again, we haven't even scratched the surface with AI, but we wanted to provide kind of a 10,000-foot view of kind of where we thought things go. Any last thoughts from either of you on the AI piece as we head into 2025? No.
Nothing for me.
Okay. Well, good segue, I think, then into our next topic, which is going to be preparedness. And we spent a lot of time talking about preparedness, doing things to make sure that our personnel are as prepared for whatever happens to come across. I've had folks that have reached out to me, I'm sure the two of you have had this as well, that as these recruitment and retention challenges that we're facing as a profession have manifested into an even bigger situation. I've had people from the outside that know my background that said, hey, talk to me a little bit about a career in 911 and what to expect, those kind of things. A big part of that is making sure that we're giving these folks that are coming into the profession for the first time enough information so that they got a baseline of what they can expect when they get in there. But again, once our folks are in the seat, a lot of the time, I say maybe 85 to 90% of the time, the calls that are coming in to a 911 center don't necessarily rise to the level of a, catastrophic, true, crazy emergency, right? It's that top 5 or 10% that really rise that level that we train for every single day. But to that extent, there's been some situations that have occurred over 2024, some quite recent, of course, that have really tested our abilities, not only in the centers, but as communities to kind of address these situations. And Melanie, I kind of want to throw it to you. And we did talk a little bit about this before the session today, but something very near and dear to your heart, of course, based on where you're located, but some of the things that have happened. Maybe you can elaborate on that subject a little bit.
Yeah, so I am in North Carolina, and as most all of you know, our western mountains were decimated from Hurricane Helene when it hit back in September. We were fortunate in the respect that North Carolina built out a statewide EZNet, and actually the last PSAP to on board was done February the 28th. So all of our PSAPs are on the statewide EZNet. And so as these 911 centers in the western part of the state started going into an abandonment role, their calls were load bearing to larger PSAPs across the state. So we started answering calls. There were, I think, 18 or 19 total PSAPs that went into an abandonment route. And so the larger centers, Raleigh Wake, Durham, Fayetteville, Guilford Metro, we started answering those phone calls for those people in other counties. I can't say enough praise for our NMAC team, for our SWIC, our statewide interoperability coordinator, immediately started moving things to get a western branch set up over towards the mountains so that they could help those centers. But the level of devastation to us, several of the TERT teams that responded from other states. One of them led by a very good friend of mine, and he called me on the third day and said, "This looks like a complete war zone." He said, "I've never seen anything like this in my life." And we had several days that we ended up taking those calls. And we also have a statewide radio system called our Viper system. So we were giving those calls by that statewide radio. And so the EZNet did exactly what it was supposed to do. That kind of preparedness, that's not what you think of when you think that you're going to need it. You just think about a hurricane hitting the beach, or something of that nature. You don't think about it completely decimating entire towns in the mountains, and that is what we had happen.
So having the ESI net in place in and of itself was preparedness, right?
For sure,
I mean,
for sure.
Yeah. Scott, any thoughts?
Man, what happened in North Carolina and in Southern Virginia and some other places, unimaginable. Like the stories coming out of there from the PSAPs. They were directly affected. PSAP shut down, their houses destroyed. Everyone knew someone that lost a loved one. Just unimaginable. So we're still thinking about all the folks down there. But you guys did things right with your EZNet. And I think there's a lot of lessons learned that folks all over the country need to learn about this. And certainly we are in Northern Virginia. We're going to be changing the way we operate because of what happened down there. But I did want to mention, Jeremy and Melanie, that when the hurricanes hit, the country came together. The 911 profession came together, and we were talking to South Carolina, North Carolina, Florida, Ohio, other states to try to figure out how we could help in a technological way, and also sending folks down there. And everybody was, you can use my tool, you can use my truck, you can use my portal that we use for CAD to CAD, because we're all trying to help each other and piece things together. And I think it was amazing. We looked like fire and police. When there's wildfires in California, we were working together, and it was such a beautiful thing.
I love that, and you mentioned TERT, and of course I was, I was a huge part of that program when I was on the admin and operational side of you guys. But when we try to explain the idea of the Telecommunicator Emergency Response Task Force, which is just incredible, when there's folks outside of the realm that really don't understand it, and I say, think about the mutual aid system for law enforcement, for fire and EMS, and how when one company isn't available, we send the next closest, that kind of thing. I said, TERT is really mutual aid for 911. Or mutual assist for 911. That's what it's all about. So, and here's a perfect example. And this is not the only one. We know there's been huge situations in Florida and Texas, the Gulf Coast, where TERT has been activated and done incredible things. So, in fact, I'm really proud of the fact I still reside in Massachusetts, and Massachusetts TERT just came online. So to have another state doing that is just incredible. But that outreach piece, that willingness to help that Scott just talked about, people helping people, that's really what this is all about. And Melanie, I know we're still seeing pictures. I just saw pictures yesterday from down there, and they're talking about relief efforts and the things going on. It's still, there's progress being made, but it's still a very real situation down there. So we absolutely sympathize with you and your neighbors, your colleagues, the centers down there. But I love hearing, to Scott's point, that there is this outreach going on, and that people are really doing what they can do to try to help out. Scott, I want to go to you real quick. We talked a little bit about Melanie obviously talked about the preparedness side. Specific things you're doing from your standpoint. One of the things that you talked about in our pre-show discussion was continuity of operations planning, COOP plans, those kind of things. Maybe you can speak to that a little bit, give some folks some ideas on what they can do to be better prepared.
Yeah, Jeremy, that's all I think about is when things go wrong and when there's interruptions in technology, because it really puts your jurisdiction in a bad place. Yeah. It doesn't have to be your technology. There's so many connections out there. There's all these telecom companies there's cable companies, there's tower companies, there's EZNet companies that things can go wrong, cybersecurity companies. And so like CrowdStrike, if there's gonna be an outage, there's going to be an outage, and everyone needs to prepare for it. This year, we all experienced, one of the telecom companies having an interruption. You couldn't call another cell phone, or you couldn't call the 911 center. We saw cyber attacks. We saw EZNet disruptions. And we all had to react to it. We had to figure it out and come up with another plan. And so like every center should be figuring out, what are you going to tell the public? Who's going to quickly investigate what's going on?
Yeah.
Do you have backup numbers to give to the public? And really, what do you do if you can't reach your IT team to figure it out internally? Your supervision, your supervisors are going to have to act. So I think about this all the time. It drives me nuts. But it's so important to have a backup plan for every single scenario you can think of.
Yeah, and even the ones you can't think of, right? I know that we often hear about we hear about, and first of all, I think you two know where I'm going with this. The law enforcement, the fire, and the EMS community for many years, and this is going back a ways. When we would have high profile events, big events that drew in resources from all over the place, there were many times when the ECC and the PSAP team members were not invited to these after action reviews, to these hot washes, to debriefings, those kind of things. But those days, I'm happy to say for the most part, and I'm sure it's the case in both of your jurisdictions, are pretty much gone. I mean, our folks are readily being invited to these sessions. And again, to talk to more to the mental health side of things, when we get into the debriefings and those kind of things, I mean, obviously critical there, but the after actions, the hot washes, the lessons learned, to be included in those is a big thing as well. But Scott, going back to your other thought there, truly thinking outside of the box about things that you wouldn't even think would happen. And you mentioned that one issue from a cyber standpoint. I remember I was I was boarding a plane in Detroit when that issue happened. I got to Bradley International. I came in. Of course, I came in at like 12:30 or something in the morning. As I'm walking out of the airport, and of course it was only us that had gotten off this plane. As I'm walking out of the airport, I'm looking at all these computer screens all over the building. They all had that blue screen. And I was like, oh, well, somebody didn't do their job, and somebody needed to update something, having no idea that, boy, I'm glad I got on that flight, because for 3 or 4 days after that, the flights were a mess, and we didn't realize how intertwined. But there's a great example of the what if, right? We're really thinking outside of the box. And when we're talking about how we best prepare our people for dealing with these situations, it can't just be about, well, what if CAD fails? Well, what if my mapping fails? Those are things that you should obviously be training for. But the big things that we don't even think about, what happens with X or what happens with Y? I think having that broad landscape in your mind of possibles, those are the things that really make it interesting from a planning standpoint. I think that's awesome. Any last minute thoughts on that? And I'm again, go ahead, Melanie.
I was just going to say, Jeremy, just to let everybody know, if you will be attending the National NENA Conference and the APCO International Conference, the North Carolina team will be doing a presentation on the Hurricane Helene.
Talking about after action reviews. There you go. And I think that would be great. Would love to learn a little bit more about that. And I'm sure by that time there probably will be some more coming out of this. So that'd be great. Thanks, Melanie. Got about 15 minutes left, moving right along. We got 3 topics I want to try to get in before we're wrapped up. So let's talk a little bit about school safety. We had an incident yesterday nationally. Horrible. Another active assailant incident. These things are ever happening. Unfortunately, they're not going away anytime soon. So in the spirit of preparedness, in the spirit of getting ourselves to a point where we can better prepare our folks for dealing with these, when the two of you as leaders in this space hear about those kinds of things, I think if you're anything like I was when I was sitting in the seat, I immediately think to the what if it happened in my jurisdiction? How would we deal with it? How would my people respond to this? So on and so forth. And I think as unfortunate as these situations are when they do occur, it gives those of us sitting in these leadership seats, like the two of you, the opportunity to say, hey, you know what, let me take a look at my practices, my established protocols for this, and make sure they're as polished, as shiny as they can be, so that we can adequately respond to the best of our ability. Are any of you able to? Well, I'll go to Scott first. Scott,
Yeah.
what are your thoughts on that when you hear about that and you're thinking about that?
Well, first, we're really thinking about Madison, and nobody should be going through these incidents. And there's been a couple, school shootings this year, in 2024, but this is probably the hardest thing for a center to respond to, active assailant, and it really overloads the center, it overloads the towers, it overloads the technology, and so I think to best prepare for this, first you have to prepare for it internally. Make sure you have some sort of active assailant protocol, but you really have to partner with the police department, the fire department, the schools, the county or city administration, and then your neighboring PSAPs. Because when this happens, when your PSAP or the towers get overloaded, it's going to go to the next PSAP.
Yep.
And so you really have to plan around this to set expectations on what's supposed to happen and how the technology is supposed to act. And so it's a really tough call to get an active assailant. Even in a large jurisdiction like Baltimore or Fairfax, it really takes over the center. So,
yeah. Melanie?
Yeah, I was just going to say that's the scenario that the relationships you've built with those agencies is imperative. The pre-planning that goes into those active assailant scenarios, your 911 center should be included in those always. You should always have a seat at the table when you're planning that. And we are fortunate here in Greensboro to have that relationship with our emergency management, police, fire, EMS, the whole 9 yards. So it's imperative to be involved in that from the pre-planning to the after action.
Yeah, and Melanie, you said it best, and it was one thing I was going to bring up, so I'm glad that you said that. There have been situations that have come up where conversations have gone on with, law enforcement, with school superintendents, that kind of thing, and 911 unfortunately was kind of an afterthought. And the problem with that, of course, is that 911, I didn't coin the phrase, but I've always considered it to be the hub of public safety, right? Everything that happens from a public safety response really kind of starts with 911, right? So we've got these calls coming in, we've got this information coming in, but if jurisdictions, if school districts, those kind of things are going to make those decisions or start having conversations about it, because so much of this technology is intertwined into what 911 provides. To Melanie's point, you really need to have representation from 911 at the table from the very beginning, to come in at the end and say, hey, here's this application, we want you to install it, or we want you to run something from the cloud and train. I mean, there's training that has to be done, there's logistics that have to be carried out. Is the data center going to support it? If it's cloud-based, how is that going to work with what's going on? But so many different factors. Can't stress that enough. To Melanie's point, please, if you're on this call and you're thinking about these different solutions, if you're a school superintendent, law enforcement, fire, EMS, and you're having those conversations, please loop your 911 folks in as early as possible. I just want to make sure that when the time comes to bring these technologies online and use them for the first time, that things have been well thought through. And Melanie, that's why that's such a critical piece. The information that's coming from these situations right now, and the term that, again, I didn't coin it, but we've kind of seen a shift away from active shooter to active assailant, because the events that are happening today are not solely confined to shooting incidents. We've had people wielding knives or using a vehicle as well. I mean, remember we talked earlier about just kind of thinking outside of the box. Anything can happen when it comes to one of these events, so it becomes an active assailant situation. But to that point, we really need to look at this holistically. We need to look at it from a very broad, paint it with a very broad brush as we're coming up with these plans to try to deal with that. But the information that's coming in from these scenes, and we have a lot of different industry partners out there and vendors that are creating these things, but we're starting to see more information, more activations going on from within the school, or from within the facility when something goes on. So are the two of you able to speak at all to the value of these types of things? I mean, having that intel from the actual site where something's going on before that first 911 call's even made. What are your thoughts on that? And Scott, you want to go first?
There are a lot of tools out there, panic buttons and direct dial into the 911 center. But at the end of the day, people should be calling 911.
Right.
When you bypass the actual way of getting help, it does confuse the situation. But the important part is that the 911 center typically is very disconnected from the school. And so I give, I'll put this on the vendors, the technology vendors. If you're going to approach a school, you need to approach the 911 center at the same time. Like, it's a perfect partnership. And I've seen vendors just approach the school, add buttons to it, and then it goes nowhere, or the 911 center is the last to know about it. So the important part is vendors need to approach both the school and the 911 center, and the 911 center needs to bring in fire and police, and everybody needs to be a part of the plan.
Yeah, it's a two-way street, right? I mean, if they come to us first, hey, I need to bring in my sheriff's office, PD, whatever it happens to be. Excellent point, Scott. Melanie?
Yeah, I was just going to say, reference to the panic button that he mentioned several years ago. There was a meeting in our state, and this company had contracted with the state and wanted to tell us that they were implementing panic buttons in all of our schools, and those panic buttons were going to come directly to the 911 center when they were touched. And I went, I don't think so, Tim, because who's going to be getting the calls when that happens? It'll be us. We're not going to have those coming directly into the 911 center.
Right.
And so, to Scott's point, you have to have a seat at the table with everybody. And again, like I said, I know I'm beating a dead horse, but I'm blessed here in Greensboro to have that relationship with all of our sister agencies.
Yeah, and I think, an excellent point with that, Melanie, and hopefully that's everybody's takeaway when you're considering these things. And again, we're leveraging technology to improve public safety outcomes, not just for our kids and our schools and those kind of things, but responder safety, so on and so forth. But we're looking at this from that holistic point of view, and we're considering all public safety outcomes when it comes to this, but really having all those seats at the table, to the point we made earlier about before you're going to operationalize some new technology in your centers, involve your people from the floor, because they're the ones that are doing this today. And having all those people at the table, it's hypercritical. Recognizing, of course, that we're approaching the 6-minute mark, I want to reach out to Marie really quick, just to see. She has been monitoring chat. I've been engaged in conversation with these two amazing folks. So Marie, anything from our folks before we kind of go into wrap up? Anybody who's attending? Or Monica?
Yes, sorry.
Okay, no problem.
I'm mute again. Technology failed twice today. Okay, let's see here. What were the most significant mental health and wellness challenges faced by 911 operators and responders in 2024? And also, to build on to that question, what targeted programs were introduced to address these issues?
Two very good questions. We talked a little bit about mental health and wellness earlier, but Melanie, you want to kick that one off? You can see Melanie's thinking about it. She decided what she wants to say.
Well, see, of course, our largest challenge here in North Carolina was the hurricane.
Yeah.
We had several 911 centers that immediately lost employees. I was at a center last Monday, as a matter of fact, that was affected, and she lost 5 employees immediately after Hurricane Helene, and one of them was a 20-plus year veteran, because every single call they took was someone in despair.
Yeah.
And that's all they had. They didn't have anything other than just desperate people calling. And when you repeatedly do that day in, day out, month in, month out, year in, year out, it does play a toll on your mental health. And one of the positive things that the city of Greensboro has done for our employees, we have an Optum wellness initiative that actually gives 10 free clinician appointments per event. So, and it's over 1,000 providers. We get to choose who we talk to. You're not sent to the city's EAP person anymore. So that was a positive thing. And the North Carolina NENA team here also has a wellness team that will deploy to wherever they're needed. And they've actually been to the western part of the state several times since the hurricane hit.
I didn't want to pick on EAP, Melanie, because I know that in a lot of jurisdictions that's kind of the go-to for kind of the catch-all, if you will, right? But yeah, we know that as this job, the job of our headset heroes, our first responders, has become more and more complex. The need for a higher level of therapy, of rehabilitation, of conversation, that kind of thing. It extends far beyond what conventional EAP services will generally provide. I don't want to loop them all into the same group, but I'm glad you mentioned that. Scott?
So I would say mental and physical health, just keep pushing it into your center, but don't forget to push it on yourself either. And that's a truth for me. I try to take care of everyone else. But I sometimes forget to take care of myself, and my wife reminds me all the time. And now my doctor.
That's why I've got the beads on today, Scott, because we all have significant others reminding us, and I'm sure Wes is the same way with Melanie. So
yeah, don't forget to take care of yourself. And then the other thing that we did for the first time this year is, if somebody is not doing well as a dispatcher, as a call taker, and is going through something, it could be external to the center. It could be family issues, a death, or we're so quick when they get in trouble, when they come in late, to discard them, right? All that effort and training went into building that dispatcher, and we have all these rules over here and policies that say, oh, this is your third infraction, you're gone. We considered a health and wellness retreat where you go and you get better without your cell phone, without social media, and you reset, and you can come back and in a fresh, mind and a fresh body. And we tried that this year. And I know some fire and police departments do that, but I would urge everyone to look into that and think about that. Do things a little bit differently instead of pushing people out the door when they're having a rough time.
Think back to 15, 20, 25 years ago when both of you were starting up in this profession, and how far we've come from those days to where we are now. I'm so very much encouraged for the future of our profession and really where it's going. And even though I'm on kind of the outside serving the community now, when you spend 20 years doing this work, you never truly leave it. And I'm thrilled that Intrado gives me the opportunity to continue actively being a part of trying to improve this. We really have about a minute left, guys. We did pretty well. There was only one topic we didn't get to today, but I want to kind of throw it to the two of you to kind of, a quick sum up of 24, your thoughts for 25, some parting words of wisdom for our viewers today before we wrap up. Melanie, you want to go first?
Sure. I am going to say on the mental end of things that, again, in the area of collaboration, Steve Martini and I are working on a joint wellness initiative that APCO and NENA is working with the 911 Training Institute on, and hopefully that initiative will be shared with our membership in late spring. We are actively working on it, so just wanted to give that plug for both of our organizations. I will say 2024, again, for us personally, was a better year, especially recruitment-wise, hiring-wise. Again, we're seeing 50 to 75% success rates out of our academies. I'll take it as long as we have some that stay. I think the challenges, the challenges, again, are going to be allowing people to deal with their trauma and in healthy ways of doing so.
Awesome. Thanks, Melanie. Scott?
I think we're in the most exciting time in our industry right now. And I'll just repeat what Melanie said. It makes my heart warm that Melanie and Steve Martini, I know you guys aren't married, but you're basically married now. And it's so exciting for the industry to be one family and to work on all these things. And I'll end it with that because 2025 is going to be awesome.
There were a couple of people I talked to recently, and I'll kind of admit this. When after Melanie was sworn in and Steve was sworn in, I was like, they were like, got a little teary-eyed because I'm like, I think about where we were. Not that both organizations aren't great, but when you have two just instrumental, incredible leaders that are really just truly committed to this industry working together, good Lord. All right, I'm not going to get myself going, but I'm super excited about that. I am so incredibly proud not only to call you both my friends, but that you both willingly volunteer to come on and participate in my antics when we do this. I thank Intrado, of course, for this forum and the ability to get out there and create a little bit of outreach. And as we go into wrap up today, again, thanking Melanie and Scott for their participation, not just today, but throughout the year. We're very appreciative of all the folks that are participating in the session today, the questions that you've been asking, so on and so forth. It definitely shows a commitment on the part of the public safety community, specifically the 911 community as a whole, to do better things for their people, to treat their people better, to really make the 911 profession everything that it can be and more. So again, can't thank you both enough for that. I thank all of you for your comments, your questions, your concerns on behalf of the entire Intrado crew. And Marie, my sidekick in the Share.Solve.Evolve business, who does exceptional work behind the scenes to make these things happen. It's been an incredible 2024. I'm super excited for where 25 is going. I know Melanie and Scott are as well. But on behalf of the entire Intrado crew and my crew and Melanie and Scott, I want to wish you all a very happy holiday, an amazing happy new year. And we look forward to seeing you all in 2025. My very best to all you and those in your centers as well. Take care, everybody. Thanks, Scott.
Thank you so much. Thank you.
Bye, guys.
Thank you, everyone. Take care.